So thank you so much for taking the time to speak with us after what's been a very busy morning full of talks where you yourself presented. Would you like to introduce yourself and maybe tell us why you're here?
My name is Pat Doorley. I'm a public health doctor and I've been working in the area of smoking prevention in one way or another for most of my career. Today in the college we were considering the success of the smoking ban and also looking to see the sort of things we might do to end the tobacco epidemic. So in relation to the smoking ban, it has been I would say a runaway success, and we have seen good health outcomes. For example, the Tobacco Free Research Institute has calculated that we have saved 3,700 lives because of the smoking ban, and that doesn't take account of the benefits we have achieved just from decreasing smoking rates in the population. It's from the smoking ban itself. So smoking prevalence in the population has come down from around 29% in 2003 to around 21% today. That represents steady progress, but the Department of Health have issued a policy document which says we want to get down to 5% by 2025, and in order to achieve that we need to make faster progress over the coming years. So the question is now, how do we look at ending the tobacco epidemic? Now the college brought together a group, Tobacco Policy Group, about 2 months ago. I chair that group, and we've had 3 meetings, and we have come up with an initial report which identifies just some of the big policy issues which we think are important to, as I say, end the tobacco epidemic.
Brilliant. And looking to the future, what sort of policies do you believe are critical to achieving this aim of tobacco-free Ireland in 2025?
Well, there are so many things that we need to do, and we need to do all of them well. But if we just take some of the policy issues that have high impact, for example, tobacco taxation, the plain packaging initiative, and smoking in cars, they're the ones we concentrated on today. There are lots more we could talk about, but they're the ones we just spoke about today at the meeting.
And I think during your talk you gave quite a shocking statistic in that 0.4% reduction in tobacco consumption is seen for every 1% hike in tobacco tax. It's quite shocking.
Yeah, tobacco taxation is the single most effective measure for cutting smoking rates. And economists in developed countries are agreed that usually for every 1% you increase the price of tobacco, you get a 0.4% decrease in consumption. Now the good thing about this is that with young people and with lower socioeconomic groups, you get an even greater effect. It could be up to 0.8%. And that's important. Young people are more price sensitive because they have less disposable income. When I say young people, I'm talking about children. And of course, poor people are disproportionately killed by tobacco. So the college would like the Minister for Finance to increase tobacco tax in the next budget, and indeed continuing increasing tobacco taxes in subsequent budgets. We know that the tobacco industry lobbies strongly against this on the basis that it increases smuggling. But of course, when the Minister doesn't increase taxes, they often increase the price themselves. So what we need is for the Minister to regulate the profits of the industry so that the state can benefit from any price increases. So we would ask the Minister to do that, and the Minister for Finance was the person who introduced the first national cancer strategy, which put us on the road to a 21st century cancer service. So we would say to him that he has an opportunity in the next budget to save even more lives, or to cut deaths from cancer further, and indeed deaths from other tobacco-related diseases. So we would like to see the Minister acting on that, and doing it in subsequent budgets as well.
Yeah, because I think you mentioned in your talk also there is connections between smoking and diabetes and also rheumatoid arthritis.
Yeah, that comes from the latest Surgeon General's report.
Yeah.
The first Surgeon General report came out in 1964. This is the, so we have 50 years experience of looking at the health consequences of tobacco, but also of what works in tobacco control. So one of the things that this report says is that smoking now causes more diseases. Effectively, it affects every organ in the body.
Absolutely shocking. And you mentioned about legislation which may potentially be coming through in the coming few months about preventing smoking in cars when there are children or people under the age of 18. Where are we with that at present?
Well, that legislation is being drafted at the moment, and the college would like to see that enacted as quickly as possible. Young people or children are very sensitive to tobacco smoke. Of course, there is no safe level of exposure to tobacco smoke. Young people are more sensitive, and in a car where the concentration of smoke is much greater, that represents a much greater health hazard to children. And even with a window open and a cigarette held out the window, there's still a strong concentration of tobacco smoke in a car. So we think legislation is justified in this area. And incidentally, there is a study, a new study, which suggests that children exposed to tobacco smoke while they were young show signs of vascular damage when they're followed up 25 years later. So this has to be an important public health priority, and the college would like to see this legislation drafted and enacted as quickly as possible.
Absolutely. And if you had one message for your colleagues in the Faculty of Public Health Medicine for the role that they play in, I suppose, pushing for this Tobacco-Free Ireland 2025, what would that message be? Just one.
Well, I think doctors are respected as leaders, whether they're working in hospitals or general practice, and they can have great influence on what happens. And of course, doctors are extremely busy and they have a lot of priorities in the clinical practice nowadays. But we would urge all doctors to raise the question of smoking with their patients, to offer help, try and have their own staff trained, for example, in smoking cessation methods, so that they can refer patients to for counselling or whatever other help they need, and also to think of nicotine replacement, because nicotine replacement therapy doubles your chances of quitting successfully.
Well, on that note, thank you very much for your time.